Prostate cancer is one of the most common cancers affecting men today, and the numbers are honestly hard to ignore. Tens of thousands of new diagnoses happen every single year, which works out to well over 100 men hearing this diagnosis every single day. And in today's video, I want to walk you through exactly what prostate cancer is, the warning signs to watch out for, and death, most importantly, when it's time to actually go and get checked out. This video could genuinely make a difference for you or someone you care about, so stick with me until the end. And if you think this could help a friend, family member, or partner, please pass it along to them. What exactly is the prostate? Let's start with the basics. The prostate is a small gland that sits down in the pelvis, and it's part of the male reproductive system. Picture something roughly the size of a walnut tucked between the bladder and the base of the penis. It actually wraps around the urethra. That's the tube responsible for carrying urine out of the body. Keep that detail in mind, because a lot of the symptoms we'll talk about later are connected to changes in urination, and now you'll understand exactly why. As for what the prostate actually does, its main job is producing a thick, whitish fluid. When that fluid combines with sperm from the testicles, you get semen, so it plays a key role in reproduction. Now, like almost any part of the body, the cells in the prostate can sometimes start behaving abnormally, growing and dividing without the usual controls in place. When that happens, it can develop into cancer, and in more advanced cases, those abnormal cells can invade nearby tissue or even travel to other parts of the body. Here's something crucial to understand right away. In its early stages, prostate cancer very often causes no symptoms at all. It tends to be a slow-growing cancer, and because most tumors start on the outer edges of the gland, they usually need to grow quite a bit before they're large enough to actually press on the urethra and cause noticeable problems. That said, as the disease progresses, certain symptoms can start to show up. Here's what to keep an eye on: needing to urinate frequently or urgently, especially waking up multiple times at night to go, a weak stream, or urine flow that starts and stops unexpectedly, burning or pain while urinating, losing control of your bladder, erectile dysfunction or pain during ejaculation, blood showing up in your urine or semen. If the cancer has advanced beyond the prostate itself, other warning signs can appear too. Things like persistent pain in the hips, lower back, or chest that doesn't ease up with rest, along with weight loss you can't otherwise explain. Is it always cancer? Now, a question I hear a lot: if you're having trouble urinating, does that automatically mean cancer? Not at all, and this is genuinely important to know so you don't panic unnecessarily. There are a couple of very common, non-cancerous conditions that can produce nearly identical symptoms. One is benign prostatic hyperplasia, or BPH. This is simply an enlarged prostate, and it's extremely common as men get older. It doesn't raise your cancer risk, it's just a natural part of aging for most men. The other is prostatitis, which is inflammation of the prostate, usually from a bacterial infection, and it tends to show up more in men under 50. Still, and this is the part I really want you to take seriously, if you're noticing any changes in how you urinate or any of the other symptoms I mentioned, don't just brush it off. Go get checked. Catching a potential cancer early dramatically improves the outcome, so there's real value in acting sooner rather than later. And please, don't let embarrassment stop you from booking that appointment. Doctors deal with this constantly, it's routine for them, and it's exactly the kind of conversation they're there to have with you. So what should you actually expect if you go in with these concerns? Your doctor is going to start by asking questions: what symptoms you're experiencing, how long they've been happening, whether they've been getting worse or more frequent. Then comes the physical exam. This involves what's called a digital rectal exam. Your doctor inserts a lubricated, gloved finger into the rectum to physically feel the prostate. It sounds uncomfortable, and it might be a little awkward, but it's quick, and it lets them assess the size and texture of the gland, whether it feels smooth, firm, or has any irregular lumps. On top of that, they may order a blood test known as a PSA test, which measures prostate-specific antigen levels. Elevated PSA can be a signal worth investigating further, though it's not a diagnosis on its own, just one more piece of the puzzle your doctor will use. Finally, let's talk about risk factors, because knowing your personal risk can help you decide how proactive to be. Age is the biggest one. Prostate cancer becomes significantly more common as men get older, and a large share of new cases, roughly a third, occur in men aged 75 and up. Race plays a role too. It's more prevalent in black men compared to white men. And family history matters as well. If you have a close relative who's had prostate cancer, or even breast or ovarian cancer, that can point to a genetic risk factor worth discussing with your doctor. That's the essential rundown. what the prostate is, what prostate cancer looks like, the symptoms to watch for, what a doctor's visit involves, and who's at greatest risk. If this video helped you, or if you've got your own story to share, drop a comment below. I genuinely want to hear it. And if you know someone who should watch this, send it their way. It really could make a difference. Thanks for watching, and I'll see you in the next one.